Hi, so my name is Brittany Godfrey, and my presentation is on hyperlipidemia. So hyperlipidemia occurs when the vessels in the arteries have an accumulation of LDL and triglycerides. Now, there can also be a low amount of HDL found in the blood also. So what LDL cholesterol is it's a bad cholesterol. And when you have high LDL levels, you're at risk for a stroke, a heart attack, you're at risk for PAD, and you're also at risk for heart disease. HDL is known as the good cholesterol, and you can have a low HDL, with hyperlipidemia. Now, if that occurs, you're at a higher risk for plaques and blockages. So, high HDL levels can help you combat your risk for myocardial infarctions and for a stroke. So an HDL cholesterol, what it does in the body is it helps to transport around 1/3 to 1/4 of your LDL cholesterol, and it brings it to the liver to be broken down. Your liver automatically produces and breaks down LDL cholesterols. So you really don't need cholesterol in your diet because your liver makes it itself. Anything that you eat that has cholesterol in it is extra cholesterol because you just really don't need it. Now, triglycerides, they store energy from your diet, and they can cause a buildup of fat in your arteries, which can contribute in your risk for a myocardial infarction or a stroke. All right, so for diagnostics for hyperlipidemia, your physician, if you suspect or if your physician suspects that you have hyperlipidemia, your physician will get a medical history, a family history, a physical assessment. They can also do a 10-year CVD risk screening to see what your risk is for developing hyperlipidemia, cardiovascular disease over a 10-year period. A lipid blood panel, which I'll talk about. High sensitivity C-reactive protein panel, lipoprotein panel. I'm sorry if I say this wrong. A polyopoprotein panel. Coronary calcium serum panel. So a coronary calcium serum panel, that one was pretty interesting to me because I've never heard of that one. That one uses a CAT scan to detect the calcium deposits in the coronary arteries. So interpreting that lab value, if there's an increase in the score, that increases your chance for a myocardial infarction, which I thought was pretty interesting. Moving on to the lab values, your total cholesterol, you don't want any higher than 200. Your LDL cholesterol, you don't want any higher than 100. HDL, so I found a couple values, but the American Heart Association wants you to strive for 60, higher than 60, around 60, but I've been seeing 50 to 60 for values. Triglycerides, you don't want any higher than 150. Lipoprotein, no higher than 30, and sorry again, the polyopoprotein, no more than 100. So an interesting fact, over 93 million American adults over the age of 20 actually have a total cholesterol higher than 200, which means that all of these Americans, 93 million, are at risk for hyperlipidemia. Some risk factors for hyperlipidemia. Familial history. There's actually a gene that can run through families that can make it easier for an individual to inherit hyperlipidemia. Obesity. Of course, obesity can lead to it. Nutrition deficits can lead to it. A high saturated fat diet can lead to hyperlipidemia. High saturated fat, trans fat intake. High stress. Stress can also lead to high cholesterol levels. A sedentary lifestyle. You're not out, you're not working that cholesterol out of your body, your liver's not working properly if you're not exercising as you should. Smoking or tobacco use. So certain medications can also cause hyperlipidemia, like beta blockers, steroids, antiretrovirals for HIV, and birth controls with hormones can also cause it. Some risk factors we have that can contribute to hyperlipidemia would be myeloma, polycystic ovary syndrome, hypothyroidism, primary biliary cirrhosis, diabetes, chronic kidney disease, lupus, apnea, HIV, and hypertension. Now, some complications that an individual can face with hyperlipidemia. Someone can have a myocardial infarction, they can have coronary heart disease, they could have a stroke, they could have heart ischemia, carotid artery disease, cardiac arrest, peripheral arterial disease, and microvascular disease. So you can have some pretty serious complications with hyperlipidemia. Over on this side, I have human flourishing with treatments. So the first line of medications that are used to treat hyperlipidemia are normally statins. You obviously want to let your doctor know if you're allergic to statins, if you have any type of allergic reaction to them whatsoever. But they are the first line of treatment because they work pretty well. So like a torvastatin. Lifestyle modifications are also proven to improve hyperlipidemia. So you want to have a healthy diet. You want to stop with the saturated fats, the high sodium, the high sugar diets, the trans fats. You want to stick to the veggies, the fruits, the whole grains, the fish. You want to decrease your intake of red meats. Red meats also cause hypertension and hyperlipidemia. You want to also decrease your dairy intake, so stick to like skim milk. You can switch to almond milk, low fat. You want to also increase your nut intake. The omegas that are in them, the nuts, will really help you out. Vegetable oil, something with a low amount of saturated and trans fat in it, because that really contributes to hyperlipidemia. Physical activity. So that goes along with a sedentary lifestyle. Physical activity will really help the liver break down the lipids and the cholesterols. So you want to stick to about 150 minutes a week of moderate aerobic exercise. You want to stop smoking. Smoking can cause a lot of issues. It can really destroy your vascular status, and it can also cause many things: hypertension, hyperlipidemia. It can contribute to a myocardial infarction, a stroke. It contributes to everything negative, really. So smoking cessation, number one, you want to do that. You also want to lose some weight if you're obese, if you're overweight. It's proven that a 5 to 10% weight loss can actually lower your lipid levels right away. You want to decrease your stress. Stress has more of an impact on our body than most of us would like to think. So do some yoga, anything relaxing, meditation, imaging, anything relaxing, to just a bath maybe, anything really that doesn't stress you out. So you also want to lower alcohol consumption. Alcohol is also one of those things that really aren't good for you, that should be done in moderation. And you also want to get at least 7 hours of rest at night. So during rest, that's when our body's working. So we really need to give it at least 7 hours to wind down and recover from the day that we've had. So I have a picture of an artery with a plaque buildup from cholesterol that I'd like to show. Okay. So here it is. So we have the plaque from the lipid, and then we have the little LDLs that are just coming through our blood, our artery, and we have our red blood cells. So we can see how easy it is for the plaque to build up and then occlude off, and can cause myocardial infarction, a stroke, if it travels, really anything, heart ischemia, coronary artery disease, PAD. So it is really, really, really important to get the right amount of exercise in, and follow the correct diet.